How does CD4 guide antiretroviral therapy, ART, decisions? Imagine your immune system as a fortress, with CD4 cells acting as the soldiers defending against infections. In people living with HIV, the virus targets these soldiers, reducing their numbers and weakening the immune defense. The CD4 count measures how many of these soldiers are left per cubic millimeter of blood, giving doctors a snapshot of immune health. In the past, doctors used specific CD4 thresholds to decide when to start antiretroviral therapy. For example, if the CD4 count dropped below 350 or 500 cells per cubic millimeter, treatment was recommended to prevent infections and disease progression. But recent research shows that starting treatment immediately after diagnosis, regardless of CD4 count, leads to better health outcomes. Early treatment helps preserve immune function, reduces the chance of developing AIDS, and lowers the risk of transmitting HIV to others. Even though current guidelines recommend initiating ART for everyone with HIV, measuring the CD4 count at the start remains important. It helps assess the initial immune status and guides decisions about preventing opportunistic infections, which are infections that take advantage of a weakened immune system. For example, if the CD4 count is below 200, doctors might prescribe medications to prevent pneumocystis pneumonia, a serious lung infection. Monitoring CD4 counts over time is also key. Regular tests every 3 to 6 months help evaluate how well the treatment is working. If the CD4 count rises above 500, it indicates immune recovery, and in some cases, routine CD4 testing might be reduced if the patient remains healthy and stable. However, if the CD4 count stays low despite viral suppression, healthcare providers may need to investigate other causes of immune system issues and consider adjusting treatment. In the context of sexual health and managing other sexually transmitted infections, maintaining a healthy CD4 count through effective ART is vital. A strong immune system reduces the risk of HIV progressing and helps prevent other infections. It also plays a role in reducing the chance of transmitting HIV to partners. Educating patients about the importance of adherence to ART and regular monitoring of CD4 counts and viral load is essential for comprehensive care. In summary, while the CD4 count no longer determines when to start ART, it remains a valuable tool for understanding immune health, guiding prophylactic treatments, and monitoring how well the therapy is working. Starting ART early for all is now standard practice, but keeping an eye on CD4 counts helps tailor ongoing care to each person's needs. Always consult healthcare professionals for personalized advice and treatment plans.